Welcome back. One of the big topics in the Capitol this year is going to be prescription drug affordability. There are multiple different proposals out there to try to address this issue in the state, and even Governor Pritzker is backing certain proposals, and we're expecting a big drop from him soon on this particular topic. But joining us now is Cyrus Winnett with the Illinois Primary Healthcare Association. Thank you so much for joining us.
Thanks for having me. Appreciate it.
I wanted to have you on to talk about a very specific part of this prescription drug reform, affordability reform that we're hearing in the Capitol. It's the 340B program. It's a federal program. Can you tell me a little bit about why this needs to be addressed at the state level?
Absolutely. It's a critically important program when you talk in the broader context of prescription drug affordability. So a 340B program allows certain healthcare providers, like the community health centers I represent, to purchase drugs at a steeply discounted rate from pharmaceutical manufacturers. We pass those savings directly on to our patients in two primary ways. So the first is for individuals who do not have insurance, those who are uninsured, are able to access prescription drugs at an affordable price. The second way is for our patients who they do have insurance, when we're reimbursed for those drugs, that creates savings and revenue that we reinvest back into things that are unfunded or underfunded. So this program for our patients and for community health centers all across the state is vitally important, and unfortunately is under attack from pharmaceutical manufacturers who are seeking to restrict access to these drugs for our providers and our patients.
So the way that it's actually going about changing the program, like you said, the pharmaceutical companies are basically changing the rules around this right now. How does that work, and what can the state do to really stop it?
Yeah, so what they're doing is they're restricting our ability to dispense these drugs through our contract pharmacies. So most health centers in Illinois don't operate their own pharmacies. They partner with local pharmacies like CVS, Walgreens, local independents, and others to dispense the medications to their patients. What manufacturers are saying is we're only going to ship drugs to one single pharmacy location. I mean, take into account that health centers have wide scope of services, some of them stretching over multiple counties. It's unreasonable to expect that patients are going to travel that far for their medications. So it's having an impact on the ability of uninsured patients to access the drugs that they need to manage their chronic conditions, keep them healthy and well. It's impacting the ability for health centers to create revenue that they need in order to survive. They operate under this environment where Medicaid is our largest payer. The rates are woefully inadequate. There's been historical inflation. We're looking at potential large Medicaid cuts from the federal government, elimination of programs that are incredibly important. There's this storm that's brewing that could wreak havoc on the healthcare safety net. So we've proposed legislation that's already been done in 8 other states, and about 2/3 of the country at least has either passed or is seeking to pass the same bill that says you cannot keep restricting access to these medications by limiting distribution to one location.
You mentioned the storm that's brewing around this. I mentioned the other efforts that we see in the Capitol around these ideas. Eventually there's going to be that sort of hashing it out, and that likely going to be that one bill or maybe a few bills that moves forward. How do you make sure that your specific part makes it in there?
Well, yesterday, for example, we had CEOs and leaders from our health centers and board members, patient board members here to educate the legislature about the importance of passing this legislation. For our industry, this is a must-pass bill. We simply cannot continue to allow manufacturers to restrict access to life-saving medication to our patients and to have a deteriorating impact on our financial viability. It's gone on for far too long. We are losing millions and millions of dollars in revenue to nonprofit community-based organizations that are a healthcare safety net for 1.5 million Illinoisans. That's 1 out of every 9 people is seeking their care at our health centers. And if this continues, our service capacity is just going to continue to diminish. And so it has to get done.
How does this stack up? The two major pushes that we've seen so far, we've seen the revival of the Prescription Drug Affordability Board idea, which is that sort of state oversight on prescription drug prices. And then we've heard the governor, while we haven't seen official language, he's really focused on PBM reform, pharmacy benefit manager reform. And that's been a topic that he's wanted to tackle now for quite a bit. How does there need to be this sort of scale between the two, balancing of the two, or can the ideas coexist? And does your organization really have a focus or an opinion on those other ideas?
Yeah, no, it's a great question, and I think they definitely can coexist, especially when you look at the governor's proposal, in which they're seeking to enact reform on PBMs, which are middlemen between payers and patients. And you've seen efforts around PBM reform in Illinois historically. We've done it specifically on 340B, and you've seen it done in other states. And the intent is to make sure that patients and pharmacies are not suffering from tactics from others. And the prescription drug affordability program proposal, there's some elements there that we are a little concerned about, lowering the reimbursement to pharmacies and to providers that could potentially have them earn less than what it costs them to purchase those drugs. For us, though, our main focus is on the 340B program. I think what the governor's looking to put out there in his proposal is something that we support because it's good for the healthcare system overall. Our message to the administration and to the legislature is that 340B must be part of the package that passes at the end of the year, because community health centers and their patients are suffering right now, and we cannot allow this to continue.
Why does it have to be the state with 340B? I know the congressional gridlock is always the answer, I feel like, but is this a problem that really should be addressed at the federal level, or does it need to be handled state by state?
It's a great question too, because I think what we hear that pharma says is that this is a federal program. States need to stay out of it, right? I agree. This program, there is need for broader reform at the federal level. I'm personally, through our association, deeply involved with those efforts at the national level with our National Trade Association and theirs. And we know that nothing is going to happen anytime soon at Congress. This is an issue that's on their radar, but there's no expectation that things are going to happen anytime soon. That's why you've seen 8 other states go and pass the legislation already. And when pharma has sued those states, the courts have continued to rule in our favor. Arkansas was the first state to do this. They took it to the first federal court, and they ruled in favor of the state of Arkansas, went to the 8th Circuit, ruled in favor of the state of Arkansas. They appealed to the Supreme Court, and the Supreme Court denied to hear their case. So we have a legally viable pathway to getting this done, and states do have the regulatory authority to manage what happens within their state. And that's what we're seeking them to do, is step up and say, you think there needs to be greater reform at the federal level? Okay, keep working at that. But right now, you're not going to continue attacking our under-resourced communities as a way of pushing the issue.
Well, Cyrus, thank you so much for joining us today.
Thank you so much. I really appreciate the chance to speak with you.
We'll be right back.